Let me introduce to you, this is Traci Hobson, and Traci Hobson is the Director of State Relations for the American Association of Naturopathic Physicians. Her primary role is to support pre-licensed states in moving toward licensure of naturopathic doctors. Since she started her position with the AAMP almost 4 years ago, efforts to regulate NDs have been successful in 5 states: Pennsylvania, Massachusetts, Rhode Island, Idaho, and New Mexico. She is working with multiple states, and if you look at your handout on the back, you'll see all the states she's working with multiple states that filed bills this year, with more licensure bills expected before the end of the year 2020. She is constantly working with pre-licensed states to build a pipeline of states that are ready to pursue licensure. Okay, and on my left is the Executive Director of Arizona Naturopathic Medical Association, Baron Glasgow, and he's been Executive Director since September 2016. He also serves as the Executive Director for the Hawaii Society of Naturopathic Physicians and the Virginia Association of Naturopathic Physicians. You're multitasking. Wow. Prior to joining the SCNM, Baron managed associations and chambers of commerce for nearly 30 years. He achieved the designation of Certified Association Executive from the American Society of Association Executives and graduated from the Institute for Organization Management. Baron has lived in Scottsdale for nearly 30 years. So let's give a nice Southwest welcome to our guests.
The first thing that we're going to do is show a video that was produced a couple months ago by our president, Dr. Stephen Katz, who practices up in Scottsdale. So, Joanna, if you wouldn't mind launching it, I'm going to kill the lights.
I will be your IT person, so to speak.
Hi, I'm Dr. Stephen Katz, President of the Arizona Naturopathic Medical Association. If you're not already a member, I would like to take a few minutes to tell you why you should join. And if you are already a member, I will tell you all of the exciting things that SCNM has been working hard to accomplish. Remember, the SCNM's vision is to ensure the growth of naturopathic medicine, and the major part of ensuring that growth is protecting the scope of practice for our current and future members. We have done this by donating funds and providing staff help and time to combat the FDA with regards to threats made against compounded medication. We've also kept close contacts with state representatives and senators regarding any legislation affecting our medicine, such as the stem cell therapy legislation that was brought to the state this year. We're also trying to expand our practice by gaining inclusion in the AIA concussion policy for return to play clearing. We've also helped gain approval for a pilot program for naturopathic doctors to get insurance coverage for Arizona's Medicaid program access. We also continue to work towards loan forgiveness legislation, as well as we have also resolved numerous issues due to discrimination to our profession, from lab contract and billing issues to problems with ordering supplies from some of our distributing companies. These are just a few examples of the ways in which the SCNM advocates for and protects the naturopathic doctors licensed in Arizona. For those of you who are not yet members, let me tell you some of the built-in benefits of joining the SCNM, which you can also view on our newly redesigned and easy-to-use website. We provide a mentorship program for clinical students and new docs to both expand your knowledge base as well as gain more information from seasoned docs in Arizona. This program also allows the mentor to gain up to 8 free CMEs just for providing that service to the mentee. We also offer a membership toolkit, which has everything anyone would need to both start a practice as well as maintain their practice. We now offer free first-year physician membership because we understand finances can be tight during your first year of practice, and we want the new docs to not lose contact with SCNM during their transition from student to doctor. We felt this was important because we know the new classes graduating are the future leaders of our profession. Since 2018, we have continued to provide outreach membership meetings throughout the state of Arizona. so our members outside Maricopa County are up to date and have a say in what the SCNM is working on. We organize an annual conference. This year, we are teaming up with Psych ANP to bring a new approach to our annual conference. This conference will take place November 2nd and 3rd. You can also access previous SCNM annual conferences and other CME webinars by going to scnma.org. As you can see, the SCNM has been working tirelessly to promote growth in the naturopathic profession. We are also working on major legislation moving forward, and we need all of the support we can get. Without support, our profession can only go so far. To all of the SCNM members, thank you for doing your part in supporting and promoting your profession. To those of you who are not an SCNM member, ask yourself why you haven't joined. Because being a member is an investment in your future and the growth of naturopathic medicine. Thank you.
Thanks, Ryan. Well, can I ask how many of you are members of the Arizona Association? 3. How many of you are members of any other naturopathic association? Very good, thank you. We like to know that for a couple of reasons that we'll delve into later. Now, Traci and I have very different roles, but before we delve into that, I'd like to recognize and introduce Hannah Lindsay. In case you don't know Hannah, she is the SCNM student representative on our Arizona Association Board of Directors. And so we have one student rep, and Hannah was selected from a large pool to be that person. And she plays a real critical role as kind of the bridge between the Arizona Association and the SCNM students. And so we're very grateful for Hannah and the time and effort that she puts in. So thank you, Hannah, I appreciate it very much. You also noticed that, yeah, go ahead. And
oh my gosh.
Yeah, I'm in a standing ovation. But
No.
No. You also noted that our annual conference is coming up in about a week and a half. We do provide a 40% discount for students. And so if that's something that you're interested in, give me a call. My email address is at the bottom of one of those pages that you see there. But Traci and I play very different roles. As the executive director of some associations, I focus on really what's going on in the individual states that I staff. And Traci has a much more national perspective that she'll go into. But we were asked to kind of provide answers to a few questions. One of those, what is the role of most state naturopathic associations? And Traci, why don't you talk about the pre-licensed states and the role of the pre-licensed associations?
Absolutely. And first of all, a little bit on semantics, okay? We could call them unregulated states, but we choose not to. We're calling them pre-licensed because that encompasses movement toward licensure. And that's what we want in all. It started the year at 30 pre-licensed states. Now we're down to 28 because of Idaho and New Mexico passing bills this year. Yay. And these 28 states that you have on your sheet, and my email's on there numerous times, they're all at different phases in their development. And there are maybe a handful in there where we don't have any identified naturopathic doctors in the state. There is no naturopathic association. There may be some students who are from those states, but at the moment there's no activity. So that's one end of the spectrum. Then on the other end of the spectrum, we have states that have very active state associations and have bills pending right now. So I work with all of those states through every step of the process. And I started about 4 years ago, and I developed what we call a roadmap to licensure. It's in our AANP toolkit. We have a big advocacy toolkit, and we have a toolkit for association management and development, because these state associations are all at different phases of their development. And our goal is to license NDs in all states by 2025. So if we're going to meet that goal, we have quite a ways to go. And we can't just focus on the states that have bills pending. We have to also work with the states that are earlier in their development to help move them forward. So state associations generally start by, you identify the NDs in the state. I've been trying to connect students who are from pre-licensed states, especially with the leaders in their states. It's helpful for numbers for state associations because sometimes there may be 5, like Wyoming has 5 naturopathic doctors. But there are more students than there are doctors in Wyoming who are interested in practicing in Wyoming. And that's helpful information for us to have, and it's information the legislature and the governors are interested in knowing too. So I work with states at any of those phases along the way. And like I said, there are 28 of them right now. There are a few of those that don't have any real activity. There are a couple where students just graduated in the last year or so and have moved back to the state and are working to reactivate or establish a state association.
That's
You wanna
great.
step in?
Yeah,
Where's the map? Where would we find that?
I'll show you that. I'll verify.
Thank you, I appreciate that. One of the things that's unique about a pre-licensed state, well, it's actually a couple of things. First, it's a little more challenging for naturopathic doctors in the pre-licensed state. Therefore, there are typically fewer naturopathic doctors in that state, which means that the workload that they have, which is challenging as an association, is typically spread out among a really few number of people. Now, the state of Virginia, I staff that state association. I've staffed them now since the beginning of the summer. And Virginia is a pretty big state, being right outside of DC. There's a huge concentration of population in Northern Virginia. There are about 20 members in Virginia, 20. As opposed to Arizona, we've got about 250 doctors that are members. So there's a giant disparity in terms of the number of people that are active in the association. I shouldn't say active, members of the association. But out of those 20 who are members in Virginia, there are about 5 who are active. 5, which means that the work that they need to do to get licensed, which is a really big challenge, is spread out among a few people. So that's why if you want to get involved in your state association in a pre-licensed state, you can make a big impact by just a small amount of work, to be honest with you. In Virginia, we're using students not only for some of the stuff that we're doing at the legislature, but to help us on social media, just things that need to get done by a few number of people. And so your help in states like that is great. One of the reasons that I provided this list to you that I'll talk about in a minute from Arizona is that once a state is licensed, the work doesn't end because there are in the state legislature or those that regulate naturopathic medicine or people who don't like naturopathic medicine are always trying to tinker with us. And so we want to either preserve prescribing rights, prescribing authority, scope of practice, or we want to make changes to it. We want to expand it. And so that work never ends. We also want to provide educational opportunities to our members and a number of other things that we'll talk about in a minute. And so your participation in a state that's already licensed, Arizona, we've been licensing naturopathic physicians for 80 years. Some of the states have been licensing naturopathic physicians for 100 years, but they still need your help because there's still a lot of work to be done. And so regardless of what state you might go back to or stay in the case of Arizona, your help is super needed. Do you have any further
That's
comments?
absolutely true, and I think that was a good point, because on our roadmap to licensure, the last section is, so you're licensed, now what? And the whole point is that the work does not end there. So at our office, at AANP, we have a pre-licensed team that advises state leaders, and it's comprised of leaders from a lot of these pre-licensed states. Emily Telfair of Maryland and Serena Albrecht of Minnesota lead those calls. And we have a post-license team because the work never ends. It's scope expansions, it's protecting your scope from various threats, and a variety of other issues that come up once you are licensed. So that's not really the end. So we kind of transition leaders into our post-license group once they pass legislation. And then I'm no longer the lead. Barron actually leads those calls, and Laura Farr, our executive director, is involved in that. And I review a lot of rules and regulations and that sort of thing. And I'd like to mention the FNMRA while we're talking about this, which is the Federation of Naturopathic Medicine Regulatory Authorities. Shannon Braden is a doctor, and she's the coordinator of that program. And that is the body of regulatory authorities in various states. And not to get too into the weeds about it, but naturopathic doctors are regulated in different ways in different states. It doesn't all look like Arizona. So some states have an independent naturopathic medicine board. In some states, NDs are under the medical board, and they may or may not have a naturopathic committee. And in other states, they're part of an allied health or integrated health board.
But I think the regulation part is super important to at least have the basic knowledge of. There are some states, Idaho they passed their bill, and now they're going through the process of setting up the rules and regulations that will allow doctors to get established. There's one state, and I don't remember which one,
Pennsylvania
has been working on it for 3 years, I think.
Right, Pennsylvania passed the bill in November of 2016, but the bill, when it passed, about 90% of the language was stricken from the bill. So it's a really streamlined bill that basically accomplishes title protection. But even that piece is a little bit ambiguous. I think it protects naturopathic doctor written out and doctor of naturopathic medicine written out. There are no professional abbreviations included in the statute, and there's no naturopathic medicine committee. And they passed the bill in November of 2016. They're under the Board of Medicine, and the Board of Medicine said, we don't know what to do with this. There's no scope. So they've been struggling, and they've been through a variety of public processes where they put out exposure drafts of the rules and regulations. AANP has weighed in numerous times on those drafts. They finally, at their last meeting, adopted exposure draft 4B of their proposed regulations, and there were 3 different versions. And that's the version we were advocating for, so that's good news. But it's still gonna be roughly another year before they move through the entire process with that draft, because they still have to go through more iterations of the bill and public comment periods and changes and that sort of thing. So we're looking at another year before Pennsylvania actually has regulations. In some states, it's much quicker than that. Rhode Island, fairly quickly. They passed the bill in July of 2017. At this point, they've issued 11 licenses, which is fairly remarkable because when they passed their bill, they only had 5 NDs in the state. So now they have 11. It's great news and great growth. But Idaho and New Mexico are really active, and they're both hoping to have licenses issued in summer of 2020.
That's wonderful, and that's really speedy. I go to virtually every meeting of the Arizona Naturopathic Medical Board, which is the licensing board for Arizona. I go for a variety of reasons. Number one, even though they don't like to see me there, some of our members end up down there under disciplinary actions for this or that. So I get to connect with some of our members and non-members there. But it also allows me to kind of keep the pulse of what's going on with the board. And that's another avenue where you as an ND can get involved if in fact there's a regulatory board. Here in Arizona, I think there are 4 NDs that they need to be members of that board. It's a volunteer position. I think they cover expenses, but you don't get paid for your time. But those are the folks that provide oversight for their colleagues. It's a challenging position, no doubt, because in some cases they have to make some very difficult judgment calls and carry out disciplinary actions against their peers. But it's another way to make sure that the level of professionalism with the industry stays high, is by holding folks to a high standard. And fortunately, we have some really, really smart docs here in Arizona, and I'm sure in most other states, that play that role. And so we think that that's a really critical part of the industry that's not really thought about very, very much. So why should you get involved? We've talked about that already, I think. A majority of the associations really need help, but most of the members don't get involved. Spreading the work among more people makes it easier for everyone. And frankly, when you get involved in those meetings, and Hannah could say it if I asked her to, but I won't, you get to meet some of the leaders and get involved with leaders of the association that you would never get to meet or be engaged with otherwise. And I truly believe that long-term, those relationships will pay off. And so that's a really good way to get to know practicing NDs, is just to become involved. Any comments, questions?
Well, as far as the regulatory board goes, I'd like to add that what I've seen recently, and this makes perfect sense to me because it is a lot of work to get a bill passed, but what I've seen in states like Idaho, New Mexico, and Rhode Island, actually, and Massachusetts, is that the workload shifts after the bill passes. So you typically have a group that's been really active in licensure efforts, and they've been fortunate enough in those states to be able to hand off the next round of energy, basically, and effort and rules and regulations to other NDs within the state association who also want to be active. So it's been nice to see some sharing of the responsibility there. But there's always plenty of work to do, and that's not to scare you all away, because little things matter. So if you can contribute, an hour or two a month helping a state association manage their social media or help them build a website. In fact, Alabama needs a website. Let's put that out there. If there's anybody in here from Alabama, let me know, because there's an ND there who needs some help building a website. There are lots of small ways that you can really make a big difference for these smaller state associations.
Yeah. And I might ask you to reference this chart that Traci's put together. If you look through there, and I only do this as an example, I'm the executive director of this and a couple of other associations. If you look through this list of 38 states?
28.
28, thank you. And find a number that say executive director under them, I think you'll find 2. I think that's the count, which means they have no staff person like me to lean on. All the work that gets done in the association is done by volunteers. And so that's a pointed example of why help is needed in most of these states. Yeah,
New York's the one exception, and they've had a long-term, I say long-term, she's been there for as long as I've been around, and I think she preceded my tenure with the AANP. They have a part-time executive director there who's done a lot of really great work for the New York Association. But having an ED is not a luxury that most of them can afford.
Yeah. And that goes back to the earlier comments. Small state, limited number of doctors practicing, and even limited number of members who pay membership dues. And at the same time, they need to dedicate most of their resources to licensure or whatever, so they don't have the luxury of finances to pay somebody to help staff the situation. So that's why involvement and engagement by you and your colleagues is super important.
Yeah, these state leaders really inspire me because they give a lot of themselves. And it's in some ways a bit of a thankless job, and it just goes on, and the legislative stuff is so unpredictable. In Massachusetts, it took 24 years, I believe, to get the bill through. North Carolina's coming up around 20 years. Things are looking really good there right now, but they've been fighting that fight for a very long time. And it's really easy if you have such a small group for folks to get burned out fairly quickly. I'd like to talk a little bit about New Mexico.
Please.
If I can.
You bet.
And I'll just use it as an example because I started with AANP in January of 2016. And in the summer of 2016, I got a call from a woman named Janet Gabriel. And she said, my daughter's in naturopathic medicine school. I want her to come home when she graduates. Please help me. And I said, okay, so I know you're in a pre-licensed state. And what have you done? Have you contacted the old leadership? Because there was a state association there that was active back in the 90s and then in the early 2000s. And then things kind of fizzled out, I think around 2004 or 2005. And then in 2009, the state of New Mexico passed an unlicensed healthcare act that protected lay practitioners to some degree under the laws of New Mexico. And the leadership at that time, they've been doing this for a long time, they were burned out, And that law gave them enough protection that they just kind of stepped back from licensure and said, well, this gives us enough protection to work to some degree. We're not practicing medicine per se, but we're also not going to be in trouble with the medical board. So they just kind of got really quiet after 2009. And this was a call I got in 2016. And I said, well, have you talked to the leadership? And she said, well, I've tried. So I got online and I looked at the New Mexico Secretary of State's website. The association hadn't filed their annual reports for some time. And I had interacted a little bit by email with the then president of the association. So I contacted her, tried to get this mother in touch with the previously active president of the state association. And I ended up getting in touch with the students at that time who were from New Mexico. And by then, they actually had gotten a couple of other folks that they were in school with that were going to be moving to New Mexico. So there's all this energy developing in New Mexico, but it was led by the parents of one of the students. And I worked closely with her starting in the fall, really, of 2016. When those students got there, we worked together to work through the bylaws, revise those, get the association back up and running to where they could take money, have some dues, and have some sort of budget to try to move forward. And these students and then graduates inspired the heck out of me because they did amazing work in New Mexico. And from 2017 to January of this year, I went out there twice to testify to the Joint Legislative Health Committee on the importance of licensing naturopathic doctors. New Mexico has a severe primary care shortage, as do many states. And they just, in general, there aren't a lot of doctors in New Mexico anyway, because it's just a small state population-wise. And there's a lot of poverty and a lot of rural and underserved areas. So we worked together and got good support for a bill. The bill wasn't introduced until this year, but this is a good example of a real legislative success, right? Because they hadn't worked on a bill since 2004, 2005, but we didn't introduce a bill immediately. What we did was we laid the groundwork for a bill. And one of the big issues, back to where are you going to be regulated? That was a big issue in New Mexico. There weren't enough NDs there to have a separate naturopathic medicine board because that is cost prohibitive. If you don't have enough NDs paying licensure fees to pay the expenses of a board, that's not going to fly. So we looked at alternatives, and they presented to the Oriental Medicine Board, they presented to the Medical Board, and several other groups over the course of a couple of years. And the Medical Board invited them to be regulated under the Medical Board. So, this is a great success story because traditionally, I think prior to when I arrived at AAMP, the view was kind of like, they're always going to oppose us, they're never going to be in our corner, and we're just viewing them as a competition. And I said, I don't see why that needs to be the case. There's plenty of room in the sandbox for everybody, and I see how you all work collaboratively together, and that's what we should be focused on. So they had really great presentations to the Medical Board, and the Medical Board said, we'd be happy to regulate you. And actually they had a fan in the executive director of the Medical Board who ended up being a good advocate for them. So they found a regulatory home, which was the Medical Board, which helped neutralize opposition from the Medical Society. They had an Unlicensed Healthcare Act that protected traditional practitioners or lay practitioners. They decided not to title protect the term naturopath in their bill because they didn't want to mess with that group. They said there are hundreds of them. They've been practicing here since 2009. They have their own law to protect them, and we don't want to interfere with that. We just want to be able to do what we're trained to do in naturopathic medical school, And they started out, it was the Naturopathic Doctors Physician Licensing Act, and they ended up changing it to doctors because that was one of the objections of the Medical Society that was not going to go away. But the long and short of it is that by January of this year, they had neutralized all their opposition. Bill was pre-filed. The main sponsor in the Senate was the prior chair of the Joint Legislative Health Committee. They went through 2 Senate committees and the full Senate with unanimous votes in support of the legislation. One person in the entire process of that bill moving that opposed the licensure bill. And then the governor signed it. And one of the things she said to Juliet Sweet, the president of the association there, because I had told Juliet, I worked with NMSA, and I said, how many students are interested in practicing in New Mexico? And they said 38, because they have this database and they can pull that number. So I told her, actually I gave that statistic at a hearing, one of my hearings. I said, there are 38 students who are interested in practicing here. You can help it, expand your provider pool, all that good stuff. And the New Mexico governor definitely picked up on that. And when the bill passed and she signed it, she looked at Juliet Sweet and she said, now I want you to bring me those 38 doctors back to our state. But that was one and done, because we did a ton of groundwork leading up to that. But a lot of that groundwork was because of the family of ND students, the families. It wasn't just Janet Gabriel, there were others who got involved. There ended up being one of the students, one of her parents was an attorney, so they got free legal assistance because of networking to see whose family's in the state, what do they do. I think they got some accounting help too. They got all kinds of help, just basically by recruiting students and saying, let's work together. And then those students went back to the state and they carried the ball over the finish line. So New Mexico is a great example of what can happen. Now, having said that, legislation moves differently in every state depending on what the political culture and climate is and what the political process is. So I'd like to think that New Mexico is a model for other small states, and we're going to work on trying to duplicate that, maybe in a state or two. But there's no guarantee that we'll see that kind of success. That was amazing.
Yeah, and even in states like Arizona, that we've been around for a long time, we employ some of the best lobbyists in the states. We have absolutely no guarantee that the legislation we're pushing is going to go anywhere. And I might just note that 2 years ago, this month, or last month in fact, 2 years ago last month, that we changed lobbyists. We hired one of the best lobbying firms in the state. We now have 3 lobbyists in that firm working on our behalf. I've never heard of a state association having 3 lobbyists working simultaneously for us. And even with that, there's no guarantee that we're going anywhere. The good thing in Arizona, and this is unique, there are, in the state legislature, there are committees, of course, that work on things. And there's a health committee in the House of Representatives, health committee in the Senate. Both the Senate and the House health chairs are advocates for naturopathic medicine. The current chair of the Senate Health Committee sees a naturopathic physician. And so we believe that right now, we're positioned probably better than we have been for years to get things accomplished at the state legislature. So that's really a good thing, I think, for us here in Arizona.
Well, I'm going to tell you that does happen in other states, actually. Little tiny New Mexico had 3 lobbyists representing them. And that was in part because they got a referral to the lobbyist through a legislator, actually. So you never know where your friends are going to help you out. But they got a referral, and this firm, they had three lobbyists representing them for a very reasonable fee. But most of the groundwork was laid by the state association leaders themselves. They didn't really bring the lobbyists in until the end. And it depends on your state whether that can be effective or not. Sometimes the lobbyists need to be the ones to open doors for you. It just depends on, again, your political culture and climate. But they got a remarkable deal on a lobbying team. And those lobbyists, New Mexico has a very short session. They do 30 days one year and 60 days the next. Their long session is only 60 days. So those lobbyists are extremely busy. They're already there working on other issues, so they negotiated their fee accordingly.
That's great.
And it looks good for them too, right? I mean, this victory in just a few months, first time filing the bill, and this lobbying firm helped them get it across the finish line. So it's a victory for them as well as the state association.
Yeah, that's right. I'm not going to take the time to go through the legislative, marketing, and membership and education initiatives that we have going on in Arizona. As you review them, if you have any questions, don't hesitate to tag me as we're still here. Drop me an email, give me a call. I know that your time is precious, so we'd like to answer any questions that you have.
Do you have any insight on why Nevada hasn't progressed compared to all the states around it, because they are highly regulated or have legislation or better so practice?
Yes,
I do have some insights on Nevada. and I think this is fairly well known. There used to be a pretty active push in Nevada, and the single biggest expense that a state association tends to face is the cost of a lobbyist. And I've heard many instances where the leaders of the state association end up paying at least part of that bill out of pocket, especially in a really small state that doesn't have a ton of ND members. And I think they had a lobbyist a number of years ago, and they had more NDs in the state a few years ago. And then those NDs moved out of state, and it just fizzled. There is a student who graduated recently, and she just moved back to Nevada. And I'm a bit of a stalker, by the way, on Facebook. I knew she was from Nevada. She talked to me at the DC Fly, which is our signature advocacy event in the spring in Washington, DC. So I knew her for 3 years at the DC Fly. And she talked to me about Nevada and wanting to help with licensure there. So I've kept tabs on her, and I saw on her Facebook she was out of the country for a while after she graduated. And then when she was back in Las Vegas, I saw her post that she was back, and I gave her about a week before I was on Facebook saying, hey, contact me and let's talk about this. And she did. She called me last week, and we talked a little bit about how to move forward in Nevada. So we're hoping to have some energy there soon, but it's been a bit of a struggle. Any questions about other states? I mean, this represents, we actually haven't had much of a change in what's been filed since July of this year. Wisconsin is working on a bill, and it should be filed any time now. It's been circulating to ad sponsors for the past couple weeks. Michigan should be filing a bill anytime. And Ohio, there's an ND there who works for a big hospital system, and that hospital system actually said, you can use our lobbyist. So they have a new lobbyist. I had talked to the previous one, but the new one came in about a month ago. So I've talked to him a couple of times in Ohio, and he's working on their bill too. Don't know if it'll be filed in 2019 or if it'll end up being 2020, but those are states to watch for some activity. North Carolina's bill is pending, and there's been some movement there, and it's very exciting. I think they might break up in the South sometime soon. So that's one to watch, and there's a ton of activity brewing in other places. If you have questions about any of them, I'm happy to discuss further. That snapshot that Barron gave you is something I've created in March or so of this year because NMSA asked me for information on all 30 at that time, pre-licensed states. So I put that chart together. And some people who are working a little bit behind the scenes, I didn't want to put their emails on there, so I have my email listed for some of the states that have some activity, but they just aren't to the point of having a formal state association yet. So feel free to contact me, and I can put you in touch with them. Any questions about any of these?
You mentioned advocacy events. Let's talk for a moment about those. There's a national advocacy event and another one here in Arizona. For the last 2 years, next year being the third, we do an Arizona Naturopathic Medicine Day at the Capitol. It's an excellent day. It's a couple of hours, but we call it a day. And it's our opportunity to meet down at the state capitol, bring state legislators in, and inform them about naturopathic medicine. We're going to have several tables. It looks like 4 different topic tables. One of them being education about naturopathic medicine, because most legislators have no idea of the education that you guys go through here just to become graduates of a naturopathic medical school, and other topics that are pertinent for Arizona. That's going to be on Thursday, January 23rd. Write this down, please. Thursday, January 23rd, from 9 to 11. So if you can make that fit in your calendar, you'll see the information. My Hannah's plugging in her phone right now to make sure she's there. But we always need a few volunteers to help out down there. The location is not easy to find, so we need some folks to help with directions, with setup, a few other things. But we typically get 20 or 30 legislators that come through, which is good because there are only 90 at the Capitol. And it's a really, really good event. And so, Jody, you've been there.
Yeah, I'll be there.
Absolutely. And so the other one at the national level that Traci referred to as DC Fly. You want to talk about that?
Yeah, it's our DC Federal Legislative Initiative at the national level. And we typically have 1 to 3 asks of our federal level representatives and senators. They can deal with Medicare, they can deal with veterans issues, that's a pretty popular one. They change every year, and we try to build on our work in previous years, but that's just part of the DC Fly. It's called the DC Fly, but it is our advocacy event. So we also have sessions for state leaders. It's a great opportunity to network with leaders from both pre-licensed and regulated states. We kind of divide our sessions between state advocacy issues and then federal advocacy. And don't be intimidated at all, even if you've never done this stuff. We provide a lot of training, and we do like an elevator speech session where you can learn to boil down your elevator speech. We do a mock session where you learn how to really present and open the door. And I'll mention too the difference between state legislative issues and federal legislative issues. I worked on the Hill in DC for a while, and it's rare that you get more than 10 minutes, 5 or 10 minutes with a staffer or a member at the federal level. So it moves really, really quickly. At the state level, you have more of an opportunity to really develop those relationships with your representatives and get to know them on a more personal level. But we do quite a bit of training during that event. It's great for leadership experience. And we have a lot of students who come in their first year and then come every year after that. And it's great to see them, and then I get to see you all graduate and move on and do amazing things like they did in New Mexico. It's a wonderful experience, and I really encourage you to go. And it's free for student members. Now the expenses in DC, lodging in DC and that sort of thing, it's not necessarily inexpensive, but you can find Airbnbs pretty reasonable.
DC Fly is a fabulous event, and it's a really, really good way to kind of hone your communication on issues, because like Traci said, they like to spend time chatting about what's going on back home, and you're there to conduct business, man. And so it allows you to really focus in and hone in on what you want to talk about.
Yeah, it's fun.
It is. Plus you get to see DC, which if you've never been there, what an incredible place.
Well, and our event ends with a whole health reception. We do that in the Rayburn foyer there on the Capitol, and it's open to staffers and to members of Congress, and it's usually very well attended. It's a lot of fun.
Yeah, it's packed.
Do you have dates for that yet, for next year?
I wish I could tell you yes, but I don't.
That's
I
fine.
wish to have those very soon.
Right. What other questions?
So I have a question in regards to student engagement, because I found out that we have the NMSA, which is the Student Association, but I think it's hard to kind of have, like, bridge these gaps of just, like, communication, and when there's, like, new ideas that students have, and, like, having a platform that, like, makes it accessible to talk and find people across schools. And I don't know, like, it's kind of just, like, brainstorming, like, what can we do to improve that relationship? Because, right, so if there's X amount of students that want to go back to New Mexico, but we don't know that because we're at 5 different schools and don't really communicate. How do you feel we should improve that?
And to be fair, my communication with NMSA has been mostly at the national level, and I depend on them to disseminate information. And for example, if someone, Alabama's a good example because they need a website. So I'm probably going to work with the president of NMSA to put together an email to send to the students they've identified who are interested in Alabama. So, I'm not asking them to give me email addresses directly or anything like that. I'm communicating through them to say, here's what we're looking for, have people contact me if they're interested in getting involved. I think what you're mentioning points to a bigger challenge of the profession as a whole, and there is an ongoing discussion, we may as well acknowledge here, about the structure of the naturopathic profession. The state of Washington came forward 2 years ago now at the AAND annual conference and basically proposed that we look at the structure of the profession, because right now you have the National Association and then you have state associations. There's no actual connection. They're totally independent, as is NMSA, as are the affiliates. So right now, everybody's kind of independent and on their own. We don't have a federation structure, we don't have chapters, anything like that, even though the Idaho Association calls themselves a chapter of the AANP, they're not. They're a separate association under Idaho law. So there's this broader discussion going on about the profession and how it's organized and how we can at least look at other models and consider better serving our members, because right now, if you want to be a member of the national, you pay national dues. If you want to be a member of Arizona, you pay Arizona dues. If you want to be a member of Psych AMP, you pay Psych AMP dues. And on and on. And there may be a better model that would better serve the profession, but we're in the early stages of those discussions. So for now, I'm communicating directly with NMSA at the national level. AANP has student reps, NMSA has student reps. There are student reps for some of the state associations. Even I find it a little bit confusing and being clear on what the role is. And I will take your question back to my office and say, let's try to noodle on this a little bit more and see if we can come up, even in the interim before this bigger picture discussion concludes, on how we can be better organized. It is a challenge.